Welcome to the show. You're listening to the panel discussion, Transforming the Citizen's Digital Experience in Government, sponsored by KPMG on Federal News Radio, part of the Federal News Network. I'm your host, Jason Miller. My guests today, Barbara Morton, the Deputy Chief Veterans Experience Officer with the Department of Veterans Affairs, Lori Ruderman, the initiative lead of the Reimagined Buy Smarter initiative at the Department of Health and Human Services, Guy Kiyokawa, the Deputy Director of the Defense Health Agency, and Quimby Kaiser, a Federal Advisory Principal at KPMG. Welcome to the discussion today. Before we get started, let me set some context for our conversation. The latest customer experience data from the Forrester Research found only 2 of the top 15 agencies improved between 2017 and 2018. Department of Veterans Affairs, Barbara, and healthcare.gov website both saw increases of at least 4 points. The National Park Service and the Postal Service remain the highest rated agencies to offer services to the public, while TRICARE, the government's managed health insurance for service members program, also held its rank of 3rd best program. By the time the next round of the Forrester scorecard or really any ratings or rankings come out, agencies are expecting to see improvements across the board. The reason for such optimism comes from a growing understanding of what it takes to provide exceptional customer service. A recent study by the Partnership for Public Service, for example, highlighted 3 key concepts that drive better customer experience: develop a department-wide strategy, expand employee perception of who the customers are and what they expect, and make sure the leadership has clarity and feedback from those customers. We know improving customer experience also is part of the President's management agenda. New data about agency progress is expected to come out in late June. In the meantime, OMB is pushing forward with other initiatives around customer experience. It's accepting ideas and potentially awarding $900,000 under its Government Effectiveness Advanced Research, or GEAR Center initiative. One of the focus areas for the GEAR Center is helping agencies connect federal programs with quantitative and qualitative understanding of the people they serve and capture the voice of the customer in order to continuously improve federal services. And finally, agencies have more optimism because OMB established and is now measuring government-wide metrics around customer service through the A11 guidance. So you can tell there's a lot of parallel efforts that are helping agencies understand, improve, and most importantly, develop first-rate customer experience services. So how can agencies bring these initiatives together, continue to make real progress, get those scores higher? Well, that's where our panelists come in. I outlined a lot of what's happening. There's a ton going on. So let me turn to Lori and just start with you in terms of over at HHS and Buy Smarter, Reimagine. All of this is about the voice of the customer. So what is your strategy?
Well, the voice of the customer is critical to us, and we have so many different customers. Our first customers are taxpayers. We serve them, that's our primary mission, but we have so many other customers, the vendor community, the Congress, the President of the United States. And so one of our key strategies is stakeholder engagement. We find that by meeting with our stakeholders, our customers at every level, listening to them, documenting what they think they want, looking at what they think they want, and finding ways to meet them where they are helps bridge the gap and bring them satisfaction.
So you hit a lot of the if you will, the great buzzwords: meet them where they are, understand what they want. Let's take a step deeper into the strategy. What is that strategy to do that? Because if you're saying everyone's our customer, then isn't nobody your customer?
Actually, we do a lot of stakeholder engagement where we have something called a foraging model, where we map out all the different stakeholders, and all of our stakeholders are our customers, whether they're people within HHS or taxpayers. And we map out our stakeholders at different levels, and then we have stakeholder engagement activities. We meet with them at offsites, we do mission roadshows, listening tours, we have communications, over communication. There's no such thing as over communication. And so we're trying to meet at every level. We meet with HHS leadership, we meet with HHS subject matter experts in the field, everyone from the deputy secretary all the way down to the nurse on the unit at CDC to find out what they need and how to get it to them in the way they need it.
Let me turn to Guy, because you also have maybe a smaller base of customers, but a huge one nonetheless. Right. Defense Health Agency. Talk about your customer service strategy.
So it really nests within the larger strategy. And just for some background, in 2017, the National Defense Authorization Act directed the Department of Defense to move the management of the hospitals from the Army, Navy, and Air Force to the Defense Health Agency. So that's a big movement that we've got going on right now. And to your point, we actually have some measures to track to ensure that, quote, we don't break anything in the process. And part of that is in keeping that engagement with the customer. For us, the customers are defined as the beneficiaries, so those who are eligible for care within the Department of Defense. But we also define the Army, Navy, and Air Force along with the combatant commanders as our customers, especially as we transition to the management of those hospitals. So it's a little bit twofold for us. It's nested in that overall strategy and the direction that we're heading forward on. And what I would leave you with is that our real focus that makes us different from other healthcare organizations is on what we call readiness. Remember, the Department of Defense is not here to provide healthcare. We're here to be prepared to go to war and when required, fight and to win the wars. And there's a medical element to that. So how we support that while balancing it with the 9.4 million beneficiaries that we're responsible for starts to drive then that engagement strategy with our customers. And if I could, as Laurie said, the feedback is a key part to that. At each of our hospitals, we have patient-family forums. In fact, it got to the point where Congress wanted to see it standardized across the enterprise because we were doing it a little bit differently between the Army, Navy, and Air Force. At our level at DHA, we meet monthly with the military service organizations and the veteran service organizations, and they represent their membership and provide lots of good feedback. And we've gotten to the point where some of our ideas, we bounce that off of them to see whether or not it meets some of their needs of their constituents. So that feedback piece and the strategy of engaging customers as part of our overall strategy focused on readiness.
You make an interesting point early on about making sure we don't break anything. How do you ensure you're not breaking something? What is that part of that feedback with the VSOs and MSOs, or are you looking at those metrics differently?
So it's all of the above. As everyone else could probably emphasize, patient satisfaction is a key component. It's as much art as it is science to try to get that feedback and really get at those core issues. But beyond that, as part of our measures, we look at one of our big ones is access to care, right? So we look at what is the access to care standards within the Department of Defense, both for our hospitals that we operate, but as you mentioned with TRICARE, the TRICARE contracts provide that supplement to those hospitals. And so it's the access to care standards for both what we call the direct care system, which is the hospitals, and the purchase care system, which is the TRICARE contract. So all of those measures, to include patient safety and quality, become important to ensure that as we do this big transition, that we stay with the standards that we set for ourselves.
I think to your point of it's more art than science, we'll hit upon that quite a bit during our discussion. Let me turn to Quimby from KPMG. One of the things that was you work with federal clients, or if you even work when you guys at KPMG work in the private sector, what are some of the trends you're seeing about the strategies that whether you just heard from Laurie and Guy or just more generally that you're seeing some trends?
Well, I think first and foremost, have a strategy. So it's really good to hear that organizations are developing a strategy and thinking about their customers as becoming a more mature capability that organizations have. I think we would like to see organizations obviously learn who their customers are. So that includes getting research and having a strategy around that. We have a think tank, the KPMG Nunwood Customer Experience Excellence Center, that's been doing research for 10 years on what the ideal customer experience is, that quintessential experience, and has distilled these elements into 6 pillars. And those are universal. Research has shown that it doesn't matter what you're experiencing, those attributes are the same. So know your customer, know what those attributes are and how those manifest that in your business. And then you have to do the hard work, which I think knowing your customer is hard enough. You have to do the hard work of having the organization enable that experience to happen consistently. And I think that's where what we're seeing from a commercial perspective and certainly in the public sector, that's hard. And it's hard for organizations to do that transformation that's necessary.
I'm going to put you on the spot here, okay?
Yeah.
You're okay with this?
I'm good.
6 pillars.
6 pillars.
Can you name some of them?
I knew you were going to put me on the spot.
I'm a journalist. Come on.
I can probably come up with 4.
Tell me your favorite 3.
Personalization is key, which I think you'll probably hear from others as well. Customers want it to be on their own terms, and personalization requires data. So one of the second pillars is integrity. I'm not going to give you my data unless I trust you. And you've brought up trust a number of times too, Barbara, in other domains as well as being important to the VA. There's also responsiveness as well. I would say are my the three prominent ones. The personalization and the integrity, what we're finding go hand in hand and are almost equal. Because if I don't trust you as an organization, I'm not going to give you data. If I do trust you, I will give you more data, and it becomes cyclical. It becomes a system. So you can't have a personalized experience, which is the epitome of what you want for customer experience, if you don't trust the organization to give you your data.
All right, we will do a link as well to the 6 pillars on federalnewsnetwork.com and when this panel gets posted, because I think people will be interested to see what those are. Barbara, a couple of things that popped up during the previous discussion is trust, integrity, keywords to VA. I had a great conversation with one of your colleagues, Lee Becker, because VA was the recipient of a customer service award recently, and I was lucky enough to talk with him about it, and those issues came up. But you guys have a huge goal, I think, at the end of September to improve your trust even more. So let's talk about your strategy, and we can tag around to the trust issue.
Yeah, well, first of all, thank you for having me here. It's wonderful to be on this panel with some colleagues of mine in this orbit of customer experience, both industry and government. In terms of our strategy, so it really is about how do we hardwire customer experience as a core principle and a core operating model in the department. And that's really our kind of North Star driver. We've done it in a number of ways over the last few years. First and foremost, we have a wonderful secretary whose number one priority is customer experience, which is really tremendous to have that type of leadership vision. And the way we're trying to execute that is threefold. One, what we've determined is that we need to identify clearly what are core capabilities in a framework within which to operate for experience. The core capabilities that we've identified really go to customer experience data. So always talking to your customer first and foremost before you're designing any service area, and having that real-time customer experience feedback so you can measure in real time what you're doing and the impact you're having. The second is you can have wonderful data, but if you don't put the data to work by creating tangible tools for employees to empower them to deliver better experiences, the data is not going to really do as much for you as it possibly can. So we built a number of tools in concert with the Veterans Health Administration that's been an early adopter for us in the hospital space to really try to deliver those great experiences. The third kind of core capability is technology. Everything is technology nowadays. It has to be certainly veteran and caregiver family member facing, but also employee facing, need to be state of the art and meet those expectations that we all have now in the real world outside of government. And then the fourth core capability for us is really about that in-person engagement on the ground, really having a listening capability in the local communities so we can really understand what's going on at a macro and micro level. So those are the core capabilities that we start with and that we identified for VA. The second sort of component of the strategy is really about governance, and that is something that's unique, I think, to government. In an organization as large as the department, we need to be able to have some sort of formal governance structure to make sure we can hardwire those customer experience data and insights into how we make decisions. So that's being stood up and is live now, which is really exciting. The third and final piece of the strategy is really about accountability. And when I say accountability, we mean it in terms of an organizational level, which is where the A11 comes in and the president's management agenda, but also at an individual level as well. So this year, in fiscal 19, we now have customer experience performance metrics that are included in all senior executive performance plans. We also recently amended our CFR, our Code of Federal Regulations, Title 38, Part 0, which it really represents our core characteristics as an organization. Those core characteristics now include customer experience principles. So we have a lot of drivers that we're focused on in terms of this overarching strategy, to your point, which is to really build trust around how veterans and their families interact with the department.
There's a ton there in terms of to kind of dig out from, but one of the things that occurred to me, and let me maybe start with Barbara, but let me open it up to everyone on the panel, is when is the strategy too complicated, too complex? Because in many ways, customer experience should be very simple, right? What do your customers need, and how do you know what they need, and then how do you meet their needs? So you went through 7 to 8 things, and I'm like, wow, that's a lot for your office and for VA across the board just to kind of balance.
So I think, so I think what we do is we take a multi-pronged approach. I don't think it can be a once and done. I mean, the principle, the directive from the White House and also the Secretary is very clear. Number one priority is experience. Now, what does that even mean? It might mean different things to different people, but a way for us to bake it in so it's not personality driven and it's not a trend and it's not a fad is to really make sure it's included in governance, it's included in accountability metrics, it's included in our regulations, and really helping to kind of drive us all in the same direction. I think people need those guardrails to focus on. In terms of your point about complexity versus not, at the end of the day, it really boils down to the individual, to your point, and there's an employee engagement piece of that as well. And so we want to, whenever we're building these kind of tangible tools based on the great data we have, we want to make sure that our employees and other stakeholders that we're working with, internal and external to the department, are involved in that design work. And that's really radical. It's very different. We're not just making something and deploying it. We're actually bringing the customer in, bringing the folks, the employees who are actually going to be delivering that service in, and designing together to bring that personal connection with it.
Quimby.
I would also add that I think no matter what you're transforming, and put in customer experiences, what we're talking about today, but no matter what you're transforming, strategy and execution have to shake hands.
You got it.
And there are things that you do from a strategy development perspective and things that you need to do from an execution perspective, regardless of what you want to accomplish, that you have to do. And you named a few of them.
Yes.
You need governance, you need feedback, you need input from who your customers are. You have to know what your goal is and what the outcome is that you're trying to accomplish.
And hold yourself accountable.
And hold yourself accountable to it. So all the things you just described in my mind are really the building blocks of any successful initiative that any organization is taking on. So I think if you distill it down into its components, there are certainly must-have things that you need there, but then I think there's some options that then you can consider, okay, what do we focus on that have those priorities?
Got it. Yep.
And we're going to actually go into that focus area in a second, but first we have to take a quick break. So hold that thought. You're listening to the panel discussion, Transforming the Citizen's Digital Experience in Government, sponsored by KPMG on Federal News Radio, part of the Federal News Network.